You may struggle to get blood should you require it in an emergency situation. This is because blood supply to the National Blood Service is inadequate. Well, let's just start from Nana Hima Dechi Hospital in Diskov, the main hospital serving Ahanta West Municipality there. The population there is about 106,000 people. That's according to the 2010 census. 200 patients are received at this hospital daily. The available blood there is 5 pence as of 28th of this month in this year. 106,000 people, and there's only 5 pence of blood. So that's supposed to give you an idea of what we're talking about. 106,000 people, and they all have to rely on 5 pints of blood. I have in the studio here with me Dr. Lucy Asamoah. She's the head of research development at the National Blood Service, Ghana. Miss, you're welcome, and thank you very much for your time this afternoon. So when we take the situation at the Ahanta West Municipality, as a doctor, you understand it better. What does it mean? 106,000, people in the population, and in this particular hospital, that's receiving 106,000 people daily. If they have to deal with 5 pints of blood, what does it mean?
It means the blood is not enough. That's
the very basic and
the simplest way to put it.
The simplest way to put
it. Because according to WHO recommendations, we require 1 unit of blood per 1,000 population.
Okay.
So.
And what's the difference between the units and the pints?
No, the unit and the pint is the same. Sorry, 10% of the population.
Okay.
I'm trying to get that right.
Okay.
So 1% of the population, 10 units of blood per 1,000 population. That's the minimum requirement.
Okay.
So for 106,000 population, we require 1% blood. The number of units, which is 450 mils, that is equal to 1% of the population.
Okay,
so
that's a lot of math, I must say, and I don't like math.
Yeah. I mean,
and I'm sure there are lots of viewers who don't like math like me.
A bit confusing. So let me put it if you look at Ghana as a country, our population now is about 28 million, and the minimum requirement is 280,000 units for the country. So that is the way to break it down.
So we should have, ideally,
280,000 units per year.
Okay.
Per year.
280,000 units every year.
Per year, yes.
Okay, and what do we have at the moment?
So for the year 2016 and 2017, we had around 160,000 plus or minus, which means that we have a gap of about 120,000 units.
Wow, 120,000. How are you going to get that?
No, how are we going to get that? That's the question, because it is
indeed,
the responsibility of every Ghanaian to donate. We all know that blood cannot be manufactured.
And you can't blame government for that.
You can't blame government for that. We can blame everyone, individuals, governments, because everybody has the responsibility to contribute to this.
Now, some people have said that the way that the National Blood Service, goes out to ask for people to come and donate blood, when you have a lot of people come in, that you have a difficulty with storage. Is that the issue?
No, we don't have a difficulty with storage at all.
How long can you keep blood, for example?
So the shelf life of blood is 35 days. And we have adequate storage. That is not one of our problems. Our major problem is the fact that Ghanaians are not donating blood.
Why do you think this is so?
There are many reasons. I'm trying to see where to start from, but first of all is our beliefs, our cultural beliefs. Blood has spiritual significance. You've heard about that. It has religious significance. It has, people believe that it's individual. People believe that you could transmit diseases, there is some truth to that, but that is exaggerated, that witchcraft can be transmitted. So all of these are affecting the individual's will to donate. That is just to touch on one side. On the other side is whether or not Ghanaians are satisfied with the services that they are receiving. So that is another aspect that donors communicate to us.
Yeah, they're not happy, right?
Yes, donors are not happy, but I'm not sure which service we are very happy with. I believe that as much as the National Blood Service has to put its act together and try to ensure that donors are satisfied, Ghanaians also need to understand that we will not have blood if we are not donating. So it is important that we dialogue and then we contribute to avoid unnecessary deaths.
Okay, so you've mentioned two problems so far. Yeah. One, the misconceptions you believe, or the sentimental values that people attach to blood, and for which reason they're not donating. That's one. The second one is donor satisfaction, concerns about donor satisfaction. I think that we should, I don't know if there are other issues want to add.
There are other
okay,
issues.
Let's finish with that and then I'll take
there are other issues. I mean, we live in a resource-limited country, and so we do not have all the necessary resources to be able to provide, to meet the requirements. There are religious issues. People will have beliefs that are contrary to blood donation or blood transfusion. I think I would like to mention those for now.
Okay. Now let's focus on donor satisfaction and see what are the concerns that the donors are raising and how the National Blood Service is dealing or is addressing the concerns that have been raised, because then I believe that will make the gesture of donating blood attractive to other people. So what are the concerns and how are you addressing
them? So first of all, the
them?
National Blood Service has launched a very very significant research into donor motivation, why donors are not donating blood, and the information that I've shared with you is part of that so that we can understand. Because we understand that donors need to donate blood to save lives. Donors understand that blood saves lives, but in between the two, there are many issues. So we have the research. Of course, you've seen our new facilities. We've tried to set up a more decent place where people will feel safer, because if the environment is not clean, if the environment is not comfortable, donors are reluctant to donate. That is another. We've had staff training. We have vehicles for outreach programs, and so on and so forth. But we are not, and I need to say that frankly, able to reach all our clients to be able to benefit from these interventions.
Because speaking of benefits, what I knew when I was growing up was that when you donate blood, that you're giving a card, and that if any of your family members needed blood, or if you needed blood, you could just take that card, and the moment you show that card in any hospital, they should prioritize your blood needs. But I've also heard some people complain that even with that card, you don't get that priority that you expect when you go to the hospital.
The donor card that you are talking about, which is usually known as the blood crediting, given to individuals or groups, was implemented many years ago as a way of motivating donors to donate. However, we realized that this was counterproductive.
Why?
Because you do not have enough blood, and blood expires in 35 days. And then when you give that card, somebody can come back after 4, 5, 10 years for the blood which expired. So what happens is that most of the time when these people come, we are not able to provide. We can give it on paper, but the blood cannot be given because it expired 35 days after donation.
No, but that's the person's blood. But this is how I understand it, and I believe a lot of people are spoken to understand it this way, that when I donate blood today, tomorrow when I need blood, it doesn't necessarily have to be my blood, but there has to be available some blood for me because I have donated mine, which may have been used for someone else.
So you have described this very clearly, but it doesn't work.
Why not?
Because the shelf life is so short that unless we say that after 35 days you can't have the blood, what are we going to do with the blood after 35 days and keep it for 5 years? We do not have enough donors. There are emergencies sometimes when patients come in and a single patient may consume about 30 units, 40 units of blood. We cannot ask that patient to donate 40 units of blood. So let me cut this short and say that the most sustainable way for making sure that blood is available is when blood is being donated voluntarily and is lying down and waiting for the patient. It's the most sustainable and most efficient way, because blood has a short shelf life. Many people are not donating. You know the number of units that are being donated. So it cannot be run as a bank. I think the name blood bank is another misperception, that people believe that you put your blood just like you put your money, and when you need your blood, you go for it. The blood doesn't wait for you. It doesn't yield dividends. You couldn't run it as a bank. So I think that to cut that story of crediting short, blood has a short shelf life. Not everybody that receives blood will be able to replace it in those numbers. And so if we have 1% of the Ghanaian population donating once a year, or 0.5% donating twice a year, we will be able to have all the blood that we need. And then we will avoid the painful experience of having a very ill patient on admission and running around helter-skelter trying to arrange for blood.
Okay, speaking of which, I was coming to how often is the expectation, or how often should people donate blood that will keep the system running? And you've just mentioned it already. You said that twice, if we have 1% donating once a year, you will be fine.
Yes.
Once a year.
So the interval between donations in our country is 4 months. So a person can donate up to 3 times in a year.
Okay. So I can donate 3 times.
You can donate 3 times every 4 months. If you are sane and you have enough blood, you can donate that.
And that's just human phenomenon. It's just really natural that when people do things, when people are incentivized, when people are encouraged, are rewarded, they get to do more. And so even though, and I am all for donating and encouraging people to donate, but once again I have to come back to you with this question. Even though you seem to have answered it already, I want you to reiterate it again. I mean, what is the motivation?
The only motivation for donating blood is to save lives. That is the only workable motivation.
Okay.
Because which reward system are we going to give? The cost of blood is borne by the patient. And I need to tell you that the people who use the most blood are the most underprivileged in society. That pregnant woman who didn't attend antenatal and is bleeding profusely, a child with severe malaria who is anemic, and most of the time even the minimum cost that is assigned to the blood is not paid, and these people are not able to replace. So if we put a cost for reward on the blood, they will not be able to pick that cost. And then it has been established that when we try to reward people for donating blood, it kind of pushes out or discourages those who are donating to save lives. Countries that started paying and giving reward for blood were never able to sustain their voluntary blood donation. The countries that have progressed and been able to sustain voluntary blood donation and achieve self-sufficiency in blood supply are those who are based on the voluntary donation system.
It makes a lot of sense to me. It does make a lot of sense. So what it means is that that card system is no longer
the card is for the donor's records.
Okay.
The card is for your records so that we know how many times you've donated, and then we know your blood group. We will be able to counsel you if there is any problem. It was used, I need to admit that, years ago it was used. Sometimes I think we are forced. At the blood service in Accra, it is not used, but in the districts in the region sometimes is used, but it is not a sustainable system. It is not an effective system. And it is counterproductive, because then the donors come to try and get the blood, they do not get the blood, and they get angry and stop donating.
So to what extent do you receive blood that's healthy? And to what extent do you, how much blood, for example, in a year do you receive, and how much of it do you have to discard because they're probably unwholesome?
I need to say that making sure that blood is safe is a process that starts before testing. So we look for donors that have donated multiple times. That's the first focus. They are safer. We look at communities that are safe. And then,
what does that mean? Communities that are safe?
So in Ghana, I need to tell you that, for example, if you take hepatitis B prevalence, it is much higher in some places than other places. So we would focus on where the prevalence of transfusion transmissible diseases is lower. And then we focus on that. And that is as much as I'll say about that. And then we take the donor through a process. So first of all, we give you information, we register you, and then we let you go through a questionnaire, which will let you yourself establish whether you think you would want to donate. We outline the risk factors there, and then you tell us whether you would want to donate or not. And you could decide to walk away quietly without talking to anyone. And then when you have established that you are safe to donate, and safety may mean that you have a fever, which could mean that you have malaria, you've had a tooth extraction, which could mean that you could have an infection. So I think another misperception is the linking of certain diseases to blood donation.
Like HIV?
Like HIV.
Is it true that about, I mean, recently we heard that the HIV prevalence rate has actually gone up, and there's so many explanations explanations that have been given, especially by the Ghana AIDS Commission. But is it true that about 25% of the blood you receive sometimes are
No way. We are not discarding, I mean, for all the reasons, and we discard blood for a number of reasons. For example, if the vein was too small and we couldn't get a significant amount because of the anticoagulant, we could discard because it is punctured. For all the blood that we discard for all reasons, I mean, I'm not sure we are discarding up to 1 or 2% of the blood.
Not even up to 1 or 2%.
HIV prevalence, hepatitis B prevalence is much, much lower in our blood donors because they are pre-selected.
That sounds good. But how do you intend to get people, and this will be getting to my final question, maybe one more question, but I think I want to make this my final question. How do you intend to bring people on board? There's the social media these days. Everybody seems to be on social media. How is the blood service galvanizing, the support, whipping up the interest of people, telling people about the need to save lives by donating your blood? How are you using, for example, social media or any communication channel to do this?
So that is education, and we do education in so many ways. Social media, we have a Facebook page, we have WhatsApp, we try to reach our donors. We're setting up a donor contact center, which will run full time and be able to provide information. We are on Twitter, we are on, I mean, we have tried to reach the donors in many ways.
And are these pages sponsored?
No, we are running by the National Blood Service.
No, I mean the pages, the social media pages that you run.
Whether we have followers.
If they're sponsored, if you sponsor those pages, then it's like you're paying for them to advertise it, so they push it to people so that it reaches a lot
it's only
more
the
people.
Text messages that are sponsored for now.
Well, I think you should consider that. Because it's not a lot. I think it's about $1 or so for Facebook, for example, and they'll be pushing it out. So you don't necessarily need to do so much work to reach a lot of people.
Okay. I think we'll look at that.
I'll bring my invoice later.
We'll look at that, but we definitely, as we are here, need the support of the media to be able to reach out, because we do a lot of driving around and walking around face to face. Does very well. put most of our resources into educating potential donors and donors, but we need to be able to reach out further.
Certainly, and I believe social media is a great way to reach out to people. But do you have the numbers for the center, the donor call center you said?
No, it's not taken off yet, but that should be very soon.
We're here anytime you're ready.
Thank you very much.
We'll share it with the rest of the world. Thank you so much, Dr. Lucy Asamoah. Dr. Lucy Asamoah Akoko. She is the head of development and research at the National Blood Service Ghana. They need blood. And in fact, we need blood. We need blood because people are dying because they don't have blood. But we have a lot. And I mean, when it's your birthday, you can just organize your group of people. You go there, you know, make a donation. When you're happy, you're very excited. By the way, not drinking, you can just go there and donate some blood because people may die. Just that blood that you donate will save a life. And you certainly want to be credited for that. Thank you very much for coming.
Thank you very much for having me.
And I wish the National Blood Service all the very best.